Diabetes is a condition that I'm seeing more and more of in my practice and getting more and more referrals for it. And it's because really our results have been more than spectacular. I am sick and tired of hearing that type 2 diabetes is not reversible, when in fact it is. Matter of fact, I've heard even estimated that 85% of diabetes is reversible, and that's even from the medical community. But yet it seems like the media and what I hear coming into my clinic is saying, well, my doctor said I'm on these medications for life. And that really, really irritates me, considering that we see patients get off all of their medications, and I can't tell anybody to come off their medications. However, working along with their doctor, we see them coming off these medications. Look, if you get to the cause of the problem, the body can always heal itself. We have to really understand the cause of diabetes today to really understand how to fix the condition. We understand that things like sugar, refined grains, white breads, etc. are one of the major causes of diabetes. But today, new research is indicating that it's a problem of toxicity that's causing inflammation of the cell, and it's causing the hormone insulin not to be heard by the cell. And obviously, if we understand this new cause, then we can take treatment to a whole new level. I have a very specific treatment plan for diabetes, and it starts with the diet. The cellular healing diet gets rid of all grains and sugar in the diet. And the reason for that is once these hormone receptors are not working or have been blunted, the only way to fix this condition is to get rid of everything that turns to sugar. It works. However, there's this other half of the patients that will not get well, or they get partly well just with the diet. Toxins play a major role. Why? Because toxins blunt these hormone receptors. So I don't care what medications you're taking, I don't care what diet you're on, I don't care what supplements you're taking. Unless you remove that cause, you're never going to reduce the inflammation. You're never going to get these hormone receptors working correctly. The diet and addressing toxicity is how we're getting these patients well. I hope that helps. Read some of those areas and watch some of the other videos, and you'll have an understanding of what tests we run and also how we treat these patients.